Social Exclusion by Ella, Dalton, Danielle, Samuel, and Kathy. Social exclusion occurs when people are unable to participate fully in society. We will discuss poverty as our exemplar of social exclusion in Canada, integrating course concepts as we do so. Human diversity is exemplified in poverty. For example, poverty affects both adults and children alike. We talk about social determinants of health in the context of how they contribute to poverty. Poverty itself is a determinant of health. Stress and coping, especially unhealthy coping, contribute to poverty and keep people in poverty. When people cope well, they exhibit resilience. Intergenerational trauma, however, makes this more difficult. Social justice is about overcoming inequities maintained by unfair processes and attitudes such as privilege. This we focus on when we discuss how to transform social exclusion into inclusion. Finally, social exclusion minimizes personhood as we discuss tragedies to correct the inequities experienced by those in poverty. We keep in mind that our goal is to support personhood. Let us now discuss three mechanisms for social exclusion: lack of opportunity, denied rights, and lack of voice. The limited employment opportunities contribute to the experience of social exclusion of those living in poverty. Finding employment is complicated by a low income. Income is known to be one of the most important social determinants of health. A stable income allows individuals to participate in society as they have the means to afford shelter, food, healthcare, education, and more. A diminished quality and other social determinants of health will further create a sense of social exclusion for these individuals. In particular, it may be difficult to find a job if individuals do not have an address on their resume or if they lack the money to maintain hygiene. In addition, it is harder to find a job if individuals cannot afford further education. Many have to settle for low-income jobs with limited or no benefits, temporary jobs, or unemployment. Finding a job is difficult for those living in poverty that may have choose to stay unemployed and focus on their next meal instead. Overall, we can see that employment can both affect and be affected by income. The health of those living in poverty are at risk with the limited employment opportunities, as many other factors of health are connected. Poverty does not just affect adults. It can create intergenerational trauma. Children living in families of low income can also experience a sense of social exclusion due to the lack of opportunities to promote positive child development. If parents have low incomes, they may not have access to quality daycare. This can impair children's cognitive development, language abilities, and readiness for school. Some families cannot afford any form of daycare, which further impedes these adults' abilities to find employment as someone needs to stay home with their children. Furthermore, due to the stress of poverty, many parents tend to use punitive and harsher behaviors to discipline children, which creates unhealthy attachments. Poor attachments can lead to children displaying aggressiveness, maladaptive coping behaviors, and antisocial behaviors in later years. In addition, inadequate housing due to low income that exposes children to dampness and mold can contribute to poor health outcomes such as asthma. We need to work towards preventing a cycle of trauma for the future generations. Denied right to primary and secondary education. Due to persistent marginalization and deprivation, children born into poor families have limited rights to education, which may contribute to a sense of social exclusion due to lack of connectedness, social skills, and participation with other peer groups and children. As a result of poverty, most children from low-income families who have access to education go to school hungry, which limits their ability to learn. This may lead children to dropping out of school and working in order to support their families, as well as meeting basic needs such as food. Furthermore, most children from a poor background cannot afford the high costs of a secondary education, and since education qualifications are one of the most important ways to get a job, insufficient access to education may lead to unemployment, which may lead to an intergenerational poverty trap or exploitation such as domestic labor, prostitution, or marriage as a child bride. Lack of rights to quality healthcare. As a result of the healthcare system's high costs, most people from low-income backgrounds have limited access to affordable healthcare because they cannot bear the costs of quality healthcare. This exclusion of the same rights to quality healthcare as the majority of society may have an effect on the quality of life of poor people. People living in poverty are more likely to suffer or die from chronic diseases or treatable diseases such as infection due to limited access to healthcare. Low-income people are also more likely to suffer from mental illness such as depression and anxiety, and the lack of access to adequate treatment leads to substance misuse to help them cope with stress. Finally, due to limited access to healthcare, people living in poverty have a higher death rate and shorter life expectancy from the rest of society. Children born into poverty are faced with constant stress and pressure due to their living situation, left behind due to prejudice and their exclusion from receiving the same privileges and rights as the rest of society. The lack of resources available to successfully cope severely damages their mental health, magnifying their sense of exclusion. As an example, children living in poverty are more likely to develop a psychological mindset known as learned helplessness. Individuals undergo repeated stress will believe there is no point in trying to change their situation as they feel they have no control over the outcomes. In this case, the less privileged having limited control as society continues to silence and undermine them. This learned sense of unimportance and low self-value will follow the cycle of intergenerational poverty as they lose hope and effort to overcome their barrier society holds against them, rendering them voiceless. People living in poverty are often labeled as voiceless, needing the powerful and privileged to be their voice for society to listen to them. This notion creates an image that strengthens the social exclusion of people living in poverty, as it may seem as though they are incapable or not deserving of speaking to society. This strips the people of their personhood by being denied the recognition and respect as human beings with the rights and capability as others to speak for themselves. Therefore, as nurses, advocating and giving individuals from poverty a platform where they can express themselves instead of being represented by others is vital. This will support their personhood and help overcome constructed social barriers by not being their voice, but as supporters and listeners. It would lessen their sense of exclusion as they will have the autonomy and the ability to participate in society. Implementing a public policy that addresses social exclusion toward the poor in healthcare would improve healthcare access for adults and children experiencing poverty. Policy goals could include improving universal access to healthcare, such as by addressing transportation and childcare concerns, educating and empowering healthcare professionals on ending discrimination, increasing public interest in funding healthcare services for families and individuals in poverty, bringing together representatives from healthcare, education, politics, and each of the subgroups affected by poverty to discuss and initiate solutions to overcome barriers in accessing healthcare. If implemented, such a policy would help address the unequal access to healthcare that many people in poverty experience today. Some strategies that nurses can use to advocate for equitable care and justice related to social exclusion around poverty include providing equitable, inclusive, and advocating for our patients and understanding that their situations might not be optimal for their current health status. As nurses, it is our duty to advocate and aid our patients. We can ensure people suffering from poverty are provided with equitable care and promote social inclusion, especially in their health decisions, ensuring we provide patient-centered care by giving patients the education they need to make informed decisions. This provides a feeling of empowerment and promotes personhood, since they have control in this aspect of the care they receive. We can also make sure that they are not stereotyped or victims of bias by other people in the healthcare system. We may also be able to provide some education on support groups and refer these patients to healthcare advocate programs that aid in providing affordable medications as well as possible outreach programs for employment. We can also include social work in the healthcare team in support of our patients struggling from poverty. As we conclude this presentation, we want to highlight 3 key takeaways. Firstly, because of the complexity of people and poverty, care should be holistic. We have discussed a wide variety of factors that contribute to poverty. It is our job as nurses to use our critical thinking and self-reflection skills to discern what our patients really need and want from us, not just physically, but also emotionally, mentally, and spiritually. Secondly, nurses have an active role to play in promoting social inclusion. We can connect patients in poverty to the resources they would benefit from. We can fight for and honor their rights. We can be the voices advocating for them. If we want to eradicate social exclusion in healthcare and society, it starts with us. Finally, we can provide equitable care for everyone. Patients in poverty may require more supports than other patients to achieve good health. No matter the background of our patients, nurses need to commit to providing quality, respectful, and individualized care. This concludes our presentation on social exclusion as experienced by those in poverty. Thanks for listening.